Welcome to Element 2 of TPP for Essex Partners. Element 2, Looking After the Adults. In this element, we will explore the importance of staff wellbeing and apply Maslow's hierarchy of need to adults. We need to think at the beginning of this journey about the adults and making sure that they have the support in place they need to look after others, whether that is a child or young person or other adults. We've listed all the content that we deliver in Element 2 for the full Advanced Level TPP Schools and Settings training to give you an idea of the depth and breadth it covers. The concepts highlighted in purple are the concepts that we will cover with you in our overview of Element 2 today. We apply the analogy of the oxygen mask on a plane here, as you're told that you need to put on your own oxygen mask before you can help others. The same applies to emotional well-being. We must ensure our own emotional well-being is taken care of before we can effectively support others. This is why many teams such as psychiatrists, therapists, social care, etc. have supervision. We would like you to start the session with a check-in using this blob tree visual. This is a popular resource used in schools and settings to support children to reflect on their own well-being and feelings, although please note they do have copyright restrictions. School staff are also using this visual more and more to support the well-being of their colleagues in school. As they say, a picture can paint 1,000 words, or at least convey something that may not be able to be put into words easily for someone. So just take a minute now to think about which blob tree are you? Why? What's making you feel that way? Which blob would you like to be? Why? And how could you help yourself to get there? What do you need? We often hear commonalities in live sessions, such as staff feeling out of control, overwhelmed, not having enough time for their own well-being because of the court requirements to manage the emotions of other staff. Is this the same for you? We'd like to introduce you to the juggler. This represents the juggling act of managing lots of different needs that we have as adults. It's essential that our own well-being is developed and maintained in order to be able to support the children and young people you support effectively. However, often we can easily lose sight of the importance of maintaining our own emotional well-being. The reality is, however, that if we neglect our own needs consistently and drop our own emotional well-being, it becomes increasingly harder to meet the needs of others, including the emotional well-being of children and young people that we support in our jobs. We're going to introduce you now to something called vicarious trauma. Primary trauma is when you're involved in the trauma. Secondary trauma is when you observe the trauma. And vicarious trauma can be when you hear about the trauma. You can become more vulnerable to PTSD when you hear details repeated several times. When professionals work with children and young people that have experienced trauma, the empathy that they have can act like a sponge and can often absorb some of the emotions and feelings that the children and young people are experiencing, and to a greater degree when trauma is present. When this occurs, it can lead to secondary trauma. Also, if you're supporting multiple children and young people, colleagues and families who are experiencing their own traumas, this can create a layered build-up of stress for you. If left unsupported, it runs the risk of impacting your own levels of stress, well-being and mental health over time. This can lead to health issues, including both physical and mental health, and make you feel depleted and in some cases exhausted and burnt out. Although research suggests that there's a greater risk of vicarious trauma to women, namely because there's a high proportion of women working in caring professions, we know that whether you're male, female or part of the LGBTQI+ community, individuals who are highly empathic by nature are more at risk. This is also more likely to be compounded if you don't support your own mental health through regular self-care practices and if you have your own unresolved personal trauma. Research shows us that the risk is also high to professionals who carry a heavy caseload of traumatised children, those that are socially and organisationally isolated, or feel professionally compromised due to the inadequate training that they've received. So it is vitally important that in your roles you identify where you may be more vulnerable or at risk of experiencing vicarious trauma and ensure you have the self-care tools and practices in place to support buffer you. Even if you're not in a role working directly with children, young people and families, you may be in a position to provide oversight and well-being to those who are in these roles. Supporting your colleagues to manage their well-being and access well-being support systems as and when appropriate is key to the health of your team. Here we have Maslow's hierarchy of needs. You're likely to be very familiar with Maslow from the training preparing you to work with children. Maslow suggests that people are motivated to fulfill basic needs such as biological and emotional before moving on to more advanced and complex needs such as belonging and esteem. We start at the bottom of the triangle and build up from there, so if a layer is missing we cannot move on effectively, and our tower is more wobbly and more likely to fall down. He states that the need to fulfill such needs becomes stronger the longer the duration that they are denied. As you can see that our basic needs include our biological, physiological and emotional safety needs. Our social needs come from those belonging, love and esteem needs rung of the ladder, and our emotional needs encompass all 4 rungs of the ladder, from biological and physiological needs to esteem needs. What you will also see in the first 4 rungs are called instinctive and deficiency needs. This means that we have an innate drive as a human being to get these needs met, and we can respond to ourselves and our environment in ways to get these needs met. This is where we see communicating behaviours both appropriate or not. It's not until we have these needs met, however, that Maslow suggests that growth can occur, which is the final rung of the ladder called self-actualisation. We have converted Maslow's hierarchy to reflect the adult's needs in the workplace setting. It's important to ensure that your biological needs are met throughout the working day, so we ask you to think for a minute about whether you eat lunch, are you hydrated enough, and do you take regular toilet breaks? If not, then your most basic needs are not being met and you will find it difficult to consistently meet the needs of the service users you support. If these basic needs are met, you can then explore your emotional needs. As adults, this could mean that you have the confidence in your role and expectations are clear. It may also mean that you feel secure in your job and know how to access help if you need it. If your emotional needs are met, you can then move on to belonging and love. This could be that you feel part of your work community and that your contributions are valued by colleagues and managers. It might also mean that you feel that you have respect and have positive relationships at work, such as with a team or supportive mentor. If your belonging needs are met, you can then move on to esteem needs. This means that you know you're doing a good job and delivering high quality provision. You're praised and encouraged and feel safe to take risks in your work. If your esteem needs are met, you can then move on to self-actualisation, where you're able to effectively meet the presenting needs of children and families as well as maintain your own. So you can see how your own well-being is vital, as without it you will not be in the best position to consistently support those around you. The 5 Ways to Wellbeing is an NHS model that will be familiar to many of you. It fits with our values of compassion and kindness, hope, connection and belonging, but uses slightly different language. There are lots of resources that you can access online regarding the 5 Ways to Wellbeing. Think about these 5 ways of wellbeing in your work context. Think about anything you might do individually or your teams may do to promote and advocate any of these wellbeing practices. You can also search for the Every Mind Matters Mind Plan on the internet. You just need to answer 5 simple questions to get your personalised mental health action plan with tips and advice to help you look after your mental health and well-being. We have now come to the end of element 2. Please be aware that the topic of trauma and emotional well-being can be emotive and it's important to look after your own well-being. There are some useful links for accessing support should you or someone else you know need it. You can find this slide in a downloadable copy alongside our TPP webinars.